glad to have potential new partners as well on the call, as well as to have the old partners, Lao and Sri Lanka, and hopefully we'll get more partners and countries joining the webinar shortly. So for now, we're just going to get started, and hopefully other people will join soon. And this webinar is focusing on the on planning for the SDGs, planning for the water, sanitation, and hygiene SDG. And I'm seeing a few emails of people who are intending to join. So let's say we'll just give them a few seconds. Let's just give them a couple minutes, then we'll start. But for those of you that are still joining or have just joined the webinar, please could you indicate by typing your name and where you're joining from, or if you are joining with other people, please let us know who you're joining with. Thank you. And we'll start shortly. We'll start in a minute. Okay, so I think we'll get started, and colleagues will keep on joining. I see we have been joined by Engineer Gulam from Afghanistan. We've got David from Sanitation, which is a private sector agency. So we'll let our colleagues keep on joining, and those who are joining, please type in the chat where you're joining from. So I was just beginning to open the webinar. So first things, just to indicate that the focus of this webinar is on planning for the water, sanitation, and hygiene SDG, which basically follows up on the discussions that ministers had in Washington, D.C. about 2 months ago. Usually we let these webinars run for about an hour. And we would intend to have all presentations and discussions and most of the substantive questions covered by that point. However, if we get to the end of the hour and there are still questions and people who would still like to keep on with the conversation, we keep it open for an additional 30 minutes. So at the end of the hour, for those who might be busy with other stuff, please feel free, if you do intend to step out. But for those that might still have questions and those that would be responding, we request if you could stay on just for another half an hour. Like I said, the focus of this webinar is really just looking at the planning processes for the water and sanitation SDG. And the intention of the webinar is really to pull as much as we can from various lessons and insights from different countries, as well as partners on the table or on the call. And just to recap, within SWA, for those that are new, you might know the Sanitation and Water for All partnership mostly for its high-level meetings, and we just had one in April, which took place at the World in Washington D.C. During the spring meetings of the World Bank. And that meeting focused more on the Sustainable Development Goals, and there was a lot of attention on the financing of the SDGs. Now, in the past, we would have a lot of momentum building towards the meeting, and then after that, the focus would be mostly on monitoring commitments which were made at the meeting. Looking into the future, the interest is to have a sustained conversation on the Sustainable Development Goals, and having this sustained conversation at country level. At the secretariat, we're also keen to pick the good examples of progress and to showcase these experiences to others so that we could facilitate and use this platform for learning. And so you would see that some of the focus now is still on the integration of the SDGs and the collaborative behaviors and building blocks, which the entire partnership is very strongly supporting. And there's a lot of support for multi-stakeholder dialogues and action to ensure that progress on the SDGs is sustained. And we do also focus on some joint advocacy at global level and at the country level. We also hope that partners would do this advocacy going forward. So this is just to put a spotlight on the strengthening of country level processes, and where we see less ideas or lessons that emerge across a number of countries, we also like to facilitate that to happen. Now, getting back into the SDGs, I think this is no longer something that is new, in that we have been grappling with this topic for some time now, since 2015, when the Sustainable Development Goals were agreed in New York about 2 years ago. Now, we know that the Sustainable Development Goals actually imply a significant level of ambition. That these goals are not only looking at reaching universal access, but that they are also looking at pushing the bar of service up to what is called safely managed services. And this in itself is quite a significant level of ambition. So the SDGs have brought in indeed a significant level of challenge, because of how broad the agenda is, as well as the significance of having to reach everyone and leaving no one behind. Now, the joint monitoring program of UNICEF and the World Health Organization have just recently released their baseline report. They just released this report last week, and we will cover this substantially next month in the next webinar, which will focus on the reviews for the SDGs. But we just wanted to pick a few highlights from here. One of the lessons that one of the key messages in this report is that they're saying that 1 in 5 countries which have a coverage of below 95%, only 1 in 5 countries having that coverage level or below of 95%, is on track to achieve universal basic water services by 2030. That means 20% at least of the countries that have got coverage of 95% or less are on track to achieving the basic water services goal by 2030. And in fact, about 15 of these countries are experiencing a decrease in coverage, or rather, there's a decrease in coverage in 10 countries, not 15. So we do see that there's a significant challenge still in terms of moving towards a universal basic water services. This is not even safely managed services, and planning could bring in a sense of agency in terms of realizing that to bend progress towards success will require a lot of resources, a lot of institutional focus and capacity. In sanitation, the picture is even dire. That 1 in 10 countries below with a coverage of 95% or less are on track to achieve universal basic sanitation by 2030, and that there's a decrease in 20 countries. So we're talking of about 10% of the countries with coverage of 95% or less actually having even a more worrying trend, or rather sort of only 10% being on track to achieving this target. Now, there are also key issues of inequalities which persist, and these could be looked at either from where people live, or or the wealth of that people or families have, or even ethnicity and language, and by disability level, or even the level of service. And we know that the measures to extend services to poor populations, if you look at the measures that are there to extend services to poor populations, there's still significant issues in terms of policies and plans so that they could reach poor populations. And a report by GLASS, which is the Global analysis for drinking water and sanitation done by WHO shows quite some significant areas that still require work in terms of governance, in terms of monitoring and finance. And we think that to resolve some of these challenges will in fact require attention on planning. Because vulnerable groups are still being left behind, and therefore this issue of inequality could also be addressed by having robust plans that would identify where inequalities are and how to resolve them. Now, ahead of the high-level meetings, we worked with a number of countries to prepare them for the meeting, and most of the countries prepared what were called country overviews. And these country overviews had key messages on the SDG baseline, as well as the vision for the countries. And so it's interesting to see some of the messages that came out of the country overviews. We received about 33 ahead of the meeting, 33 country overviews. And of those 33, we could tell that 7 countries have got their plans aligned with the SDGs, or we're very close to aligning their plans with the SDGs, and that 5 countries were intending to prepare investment plans. This number could be more, and that the 17 countries were still intending to align their plans to the SDGs. And among these countries, 16 of them were targeting to reduce or rather eliminate open defecation by 2025, and a further 8 were planning to eliminate open defecation by 2030. So this was just a snapshot out of what we received ahead of the HLM. And we know that there's still a lot of work to be done looking forward, that strategies for not leaving anyone behind are needed, that focus on safely managed systems are key. And we know that there's also a very strong focus now on, if a country only wants to do basic services, that they could go a little further and do basic plus. So be able to reach the level of basic with some elements of safely managed. And to be able to do that, to either target, reach the target of safely managed systems or basic services, that will require a very strong focus on building blocks, issues of policies, plans, institutions, and capacity need to be in place. And that needs to be supported by development practices that are effective, that put the government leadership at the center, and that look at how to use existing systems, or how to improve existing systems. And there's a need to continue monitoring both at the national level, regional level, as well as global level, and using platforms such as the JMP and the GLASS could contribute to a furthering understanding of where the gaps exist. Now, I talked about the building blocks, and there are 5 of these, but I just want to focus on one of these, which is the one on sector policy and strategy, because that's the one that relates to the topic that we have today. So the first building block, the one on sector policy and strategy, as well as the planning, monitoring, and review building block. Now, basically, these 2 building blocks, the first one, for example, just emphasizes the need for sector policies and strategies that identify sector goals and pathways and give direction to sector investments. Now, these strategies are needed not only to know the targets and vision, but also to improve implementation, as well as focus on models, service delivery models that can be efficient. And these policies are also key because they have to show where the country wants to go in all subsectors. That's urban, rural. We're looking at drinking water or sanitation, looking at national and subnational levels, and that they have to be backed by an ongoing cycle of review, which uses data and evidence to determine the level of progress and induce course correction so that there could be progress. On the side of the collaborative behaviors, there is one that is very key to today's topic, which is the one on enhancing government leadership of sector planning processes. All the others are relevant, but I just wanted to focus a bit on this one, which basically emphasizes a process for nationally agreed sector priorities and strategies and plans. and having a cycle of planning, monitoring, and learning. And that partners, I mean, this is both for government and partners to work together to put this in place. And these are things that partners within SWA have already agreed. Now, there are types of actions perhaps that can help to show sort of a progression towards a better planning for the SDGs. So, for example, maybe some kind of questions in terms of a checklist format. Has the country, for example, done an evaluation of country performance under the MDGs? Has the country, for example, agreed the indicators for SDGs? Has the country done a reference, which is exactly the baseline for SDG target 6.1 and 6.2? And has the country agreed policies to improve changes that are required? So what we have here, just some level of steps or ideas in terms of how countries could move, looking back at the MDGs, but also looking very much focused now on 2030 and just figuring out some of these sort of milestones to ensure that this planning is on course. And with that, I want to highlight the focus of the webinar today, which is hearing from countries and partners on the call in terms of how processes for planning are going on in their country, and then using that as a point for discussion going forward. And I want to check if there are any questions or clarifications on what I have presented before I pass on the floor to our colleagues in Indonesia, and after that, our colleagues in Afghanistan, Engineer Ghulam, if your mic is ready. So I just want to check if there are any questions at this point. Please feel free to pick up the mic and ask, or type in the chat. Audi in Indonesia, if you could prepare to take over, just as I check if there are any questions in the chat.
Sitali, thanks for this webinar. And you said a couple of points like, this is Lalit, sorry.
Lalit, how are you?
Yeah, I'm fine, I'm fine. I'm not hearing from you for a long time, but anyway, I think I'll catch on with you for a couple of things later over email or maybe over a Skype call. Just to ask you, like you said that a couple of countries are aligned with their plans for SDG, and some of them are considering to. Can we get that list by any chance?
Oh, okay, Lalit, we can circulate the list. What happened was that a country that submitted their country overviews ahead of the HLMs, we went through those country overviews, and so we prepared the summary that we've shown. So we can share that afterwards, just so you could get an idea.
Sure. No, I just want to make sure that Vietnam is understood well in that contest. I mean, rightly understood in that contest at least. Yeah. So that we can also take appropriate actions from our end if something is not moving forward according to you. Yeah, I mean, I think we provided a country overview based on these 5 building blocks and collaborative behaviors, if you remember.
Yes. So
yeah, okay. Yeah. So okay. So let's not discuss further. Maybe we can talk bilaterally. Maybe we can ask Indonesia and Afghanistan, to present it. Thank you.
Okay, thank you so much, Lalit. That's very helpful. And as you say, we can still do a bilateral as well, and we're really keen to continue with that as well. So thanks, Lalit. And is there anybody else who would like to ask any question or make a comment? Okay, Audi, over to you. So if you could take over as presenter.
Sure. Okay. Thank you, Sitali. I'm waiting for the presentation to come up. Okay, I got my presentation right now. Hello, everybody. My name is Aldi Madikanto. I hope you all are hearing me well. Yes?
Yes, we can hear you. At least I can. I believe everybody else can as well.
That's a good sign if you can hear me already. So thank you for the opportunity to share our experience in preparing for SDGs 2030. My name is Aldi Madrikanto. I'm from the Directorate of Urban Housing and Settlement from the Ministry of National Development Planning, National Development Planning Agency. So I was asked to share our experience. First of all, we have a good news here from Indonesia. Indonesia has our president has just signed the presidential regulation number 59. It was just signed probably last week or 2 weeks ago on the implementation of actions to achieve SDGs. It contains the indicators related to our medium-term development plan of 2015 to 2019. And the key points of the regulations are, well, the goals and indicators. It includes non-governmental stakeholders. So it's not only talking about the ministries and the local government, but also our partners, NGOs, and everybody who's been actively contributing in Indonesia. It also mandates the coordination and task distributions, but this is mainly for ministries at the national level and also the local governments. And it also mandates the establishment of roadmap and also the national action plan, which also should be followed up by our local government to establish their own local action plans. The National Action Plan will accommodate other required goals and indicators. So basically, the regulations only contain the indicators already stated in our medium-term development plan. But as the discussion progresses in each sectors, especially in water and sanitation that I participated since last year probably, there are other goals and other indicators that are not yet stated in our medium-term development plan, but we think it's required to move towards SDGs targets. So those indicators and goals will be included in the National Action Plan. That's our agreement with the SDG secretariat. And to go towards that, the metadata has already been formulated together with the SDG secretariat, National SDG secretariat, with the sector of related stakeholders in the sectors of water and sanitation, and it's including all required indicators. I will show you the indicators later on. And to follow it up, the indicators that are not yet specifically stated in the president regulations on SDGs will most likely be included in our next medium-term development plan. So we are very much committed to to move towards SDGs on water and sanitation. I'm just going to show you the baselines that we have already prepared, both for water and sanitation. We have already formulated the definitions, and it's also referring to the metadata from the UN and from the UNICEF and also the WHO, both for the access, improved access, and also for the safety of water and sanitation management. So these are the data that we prepared for the baseline on 2016. We have presented it in Bangkok for the regional meeting on SDGs, if I'm not mistaken, back in April. So we are, first we are analyzing data, and we have to prepare for both the baselines and also the indicators and the goals. We were conducting consultation meetings with internal stakeholders within my ministry, with also the National SDG Secretariat that it sits in our ministry, and also with the related ministries like Ministry of Health, Public Works and Housing, Central Statistics Bureau, the main actors in the National Working Group on Water and Sanitation that has established since like 2003, if I'm not mistaken. We also had consultation meetings and assistance actually from the development partners such as UNICEF and with the World Bank and other like technical assistance that are supported by other countries to Indonesia. The data, mainly we are using the annual National Socioeconomic Survey by Central Statistics Bureau, but also we are collaborating, or maybe the term would be what do you call it? Not cross-check, but can I get some better word? Like validating it or comparing it with other data, such as the data reported from facilitators directly from the household, which is under the program of community-based total sanitation led by the Ministry of Health, and also some data from local governments, mainly on storage coverage and also fecal sludge management coverage. This is gained through the reporting systems from Ministry of Public Works and Housing. And also we are using other data analysis to identify priority actions. For example, our development partners from World Bank Indonesia, they are conducting analysis on gaps, the dynamics of gaps in both in water and sanitation. For example, we have their study shows that there's a decline gap in urban sanitation, but there's an increased gap in rural sanitation. So we are also digesting those data analysis to set our priority course for especially for the next national medium-term development plan, and also from UNICEF that has been dealing a lot with the community-based total sanitation. They are looking at the sustainability of ODF status in our villages. We have more than 8,000 villages that already verified their ODF status, but we unfortunately we have not been looking very much on the sustainability. So I was just showing that we are also digesting those data analysis so that we could produce a good priority action 5 years. I'm just showing now the monitoring systems. We are already identified, we are already mapped out the systems that we can use to monitor our achievement in SDGs, both in water and also for sanitation. If I may focus more on sanitation, back to the data on the first slide that I mentioned to you earlier, there are, if you can see the color, the green color on the indicators means that they are already existed in the president's regulations on SDGs. But then there are some data, as I mentioned before, the data that are that we think is required to move along the SDGs, and also the especially on the safely managed sanitation. And you can see that we have already mapped the indicators, which is the number of households covered by on-site system, the fecal sludge management systems, and also the off-site system. And we have identified which monitoring systems that we are going to use to monitor the achievement on those indicators. Also, we are, for example, we are. I'm not sure. I apologize. I have not updated the table, but we are also would like to see the number, not only the number of village as it's shown now in indicator 6.2.1c, but we would like also to have the number of households actually in the village that already ODF, not practicing the open defecation anymore. So it could translate into the proportion of people actually not practicing ODF. These are the examples that we are I was talking about, that we are trying to cover as not as many as indicators that we can, but all the indicators that we think could picture our conditions in Indonesia towards SDGs, both for access and also for the safely managed both sanitation and water. The last thing I would like to talk about is the priority actions. I admit that there are still some indicators that are not yet settled in the national level, but we are still working on it. So that would be our priority action. And in my ministry, in my unit, setting the constellation of indicators between each ministries or programs, because ministries and programs tend to establish their own indicators. So we have to really sometimes the indicators are comparable to each other, but sometimes those are not easily understood. So us at the Ministry of National Development Plan, we have the task to harmonize those indicators, so that we are at the same page at the national level, and we can give a clear direction for local governments and also for our development partners. We also are initiating review some programs, new programs, and also review some programs. For example, we are now initiating a fecal sludge management program, probably rolled out in probably 3 years of time. And with UNICEF, we are looking at the water quality monitoring tool, also program to see the water quality, not only the water access. And also we are reviewing the community-based total sanitations. As I mentioned before, we are planning to emphasize more on the sustainability besides the, of course, the coverage. And also we would like to still increase and strengthening the profile of water and sanitation, because although it has been stated in our annual national annual work plan, probably personally, I still think that it hasn't been followed up by a clear resource allocations, both at the national level as well as at the local government. So, we would like to really push on the investment on water and sanitation, both at the national and local level. I think that would be all from us in Indonesia. Back to you, Sitali. If there are any questions, I'll be happy to try to answer.
Thank you so much, Audi. Sorry, I was on mute. And thank you so for that very succinct presentation, as well as sort of starting on a very inspiring note of this very latest news. So I should think there should be questions. The floor is now open for those colleagues with mic-enabled devices. Please, if you do want to ask, just pick up the floor and ask. If your device is not enabled by mic, you can type in the chat, so then we could get Audi to respond to any questions.
Okay.
Do we have any questions?
Sitali, I don't think we have any questions. It's very welcome development in Indonesia. I think we have also similar kind of development here, although we have not presented it. I think some of the things which I can highlight is basically the SUV costing is going on. The urban costing is taking a little longer time. The indicators and all is being developed in consultation with flying ministry. There are 4 or 5 ministries involved in these indicators, basically to make sure that our indicators at the global level are aligned with the national indicators. I think a lot of things are developed in a similar direction. Maybe we can also present next time if you wish so. But yeah, that's focus for now. Yeah, thank you.
Thank you so much, Lalit. That's very, very interesting as well. So, a few things that I was able to capture. So, you say the SDG costing is going on, and then there were other things, but then the line was not so clear. So, if you could just type even in the chat, I think that would be good. Now, the question I have for you, Audi, is
Sure, Sita.
the engagement at the presidential level. So, we're seeing very huge influence in India in terms of the president getting involved. Um, uh,
Right,
and I mean, if you look at some of the other countries that made progress in the 70s or so, also people have
right.
said that that had very high level sort of political support. How did you get that in Indonesia? Did the president just do this out of his or their party agenda, or was there sort of the sector influencing that to get that attention?
Thanks, Italy. It has always been tricky to get the attention from a high profile, especially for a president. Uh, but luckily, our current president, Mr. Jokowi, his policy, his like overall and general policy is to touch based on human like basic needs of the people. Uh, for example, he was pointing out that we as the government should develop from the what do you call it? Not from the center, but from the
Oh, this.
peripheral.
Okay.
For example, that's one of the emphasis that our president are giving to the government, uh, and also he always sees um, the people needs to be taken care of, like not superficially, but like an actual cost, and that I think that resonates a lot with the nature of water and sanitation development. The sector gives like a basic service to the people. As of right now, we can I can be sure of saying that our minister has given good attention. For example, by attending the HLM back in April or May, yeah, in Washington D.C. And he's been very fluent in talking about our sector, mostly on water. For example, at the SDGs event back in I think last year, also like a few months ago. That's what I can be sure of saying. That our ministry is very keen to see the sectors develop. But I could not say as of right now that a president is giving like a specific like attention to our specific sector, water and sanitation. But something that we can be sure of is because our current president was a mayor of Surakarta back in 2000 something, 2010 if I'm not mistaken. No, 2006. That's where our national sanitation program, which gives a clear direction on the importance of the city to develop their strategy for sanitation development, begins. And Mr. Jokowi, our president right now, was the mayor one of the 6 mayors that initiated the program. So we can be sure that he are still aware of the necessity of the sectors to develop, and that we should prioritize the sector. We just haven't been in touch lately with him in talking about a specific a sector, and specific our sector development. I mean, but
Okay.
yeah, we can be sure that our president is on board on that.
Okay, that's good. So there are a few questions that have come up, which is really good. The conversation is getting interesting. So one question related to just what you responded to.
Yes.
So Nelson, who's recently joined the Secretariat of the Sanitation and Water for All, and he's moved from the African Ministers Council on Water to join us. So he's asked this question. Please just clarify for better understanding. You mentioned the presidential regulation signed by the president on SDGs in the presentation. Does it cover the implementation of SDG 6 on water and sanitation, or it covers the entire SDG agenda? And then if you could talk on how the private sector also involved in these processes.
It covers all the indicators in SDGs, and we have aligned them with our national targets and stated in our National Development Plan 2015 and 2019. And all other required indicators that are not stated in our National Development Plan of 2015-2019 are going to be included in the National Action Plan that is mandated by the presidential regulation. As for the private sector, I can't remember specifically, but I'm sure that the regulation also states that all other partners, from development partners, international ones, national ones, NGOs, and private sectors included, should contribute to the achievement of SDGs as stated in the presidential regulation.
Okay, thank you so much, Audi. And I think we'll take one question, which is the question from Majeda, who's in Palestine. She works for the Palestinian Water Authority. And her question, I'll just read this. Thank you for the presentation, for the FECO sludge management, I guess. We're still far away. If possible, it would be good to know more about the program that you mentioned. So could you spend maybe a minute on that, and then we'll give the floor to Engineer Ghulam in Afghanistan, and I have his presentation as well, which I will upload as you speak.
Sure. Thank you for the question. Yes, we see a lot, a majority of our sanitation system is on-site system, both in urban and rural. And we are aware that in urban settings that could pose a higher, so that we are establishing this program of fecal sludge management. Basically, we are facilitating the local governments to set up an improved fecal sludge management that is a regular dislodging of septic tanks of households, but not only improving the systems for regularly dislodge septic tanks of households. The facilitation of local governments also pushes the local governments to establish a good systems, a good regulation, including tariff systems, subsidies, and also to facilitate them to establish a good institutional structure, meaning that we need to see that the government is assigning a specific office to take care of the fecal sludge management. So it's not only a technical assistance at the technical aspect, but also we are covering the regulation and also a institutional aspect of the systems. I think that would be that in a nutshell.
Okay, thank you so much, Audi. I think we're so grateful, I mean, that you could join and for this really insightful presentation.
Thank you,
colleagues who are on the call, if you have more questions, please keep on sending them in the chat. We'll come back to Audi when we get to the end. Engineer Ghulam, your presentation is up and running. You can let me know. Let me know if you can see the slides.
Yes, I can see. Very good morning to everybody.
Okay, and good morning. So if you see the slides, you can tell me to move them forward, or if you want, you can take over as presenter. So you just click on the button that says take over as presenter, and then you'll have the liberty to move the slides as you will.
Okay, great. Thank you, Setali. Very good morning from Kabul to all participants. Very happy to join the meeting. So the slides looks few, but I've given 5 to 7 minutes. So I'll try to finish it into that. So let's just move from this slide because it's all the issues that I'm going to share with you very briefly. Here, just as you might know that having the SDGs, commitments by our country, and after the MDGs, before the SDG also, while we had the MDG para, the Afghanistan National Development Strategy that we are calling ANDS was also prepared in line with the MDG. And as you can see here, the MDG Goal 7 shows, the targets and the indicators. And in the next few slides, I'm going to also share you what has been achieved so far. So in that, the objective was quite ambitious, that by 2013, while the ANDS was from 2006 up to 2013, that our aim was to cover 90% of the rural communities and, of course, 50% of the villages through the sanitation. So that was the plan. Can I? Yeah, it's okay. So then to do that, we had, initially the water sanitation and hygiene national policy. And for that, we had the goals, of course, the goals are always the same. That is, improvement of the life, to do the improved access to wash facilities. And down to that, you can see the targets and the objectives. So some of the standards based on the Afghanistan context. So I don't want to read all that, but one of the things that we had committed that, by 2016, we were supposed to reach by 70% of the communities through drinking water and sanitation up to 50%. We are on track on the drinking water, but not on the sanitation. That I'm going to just explain the reason after. And in the right side, you can see, the results and indicators. Here are some photographs that from the services that we were supposed to deliver. And of course, we have learned a lot from, as I'm doing learning by doing, and then based on the policies. The good thing in Afghanistan is that over 80% of the rural communities are using sort of toilets. It's not hygienic toilets, but there are toilets that people are making traditionally. So now in the SDG para, we have, as I'm going to explain in the next slides, under the Citizens Charter, which is now a national priority program that we have designed in line with the SDG goals and targets for the whole sectors, including WASH. But in the MDG para, these were, the services types and options that we were doing. Here, the photographs are only on the hand pumps, but we had also the water supply networks. Based on the policies, the options was based on the geographical conditions. So any options was feasible was the first, but the preference was to use the surface water. Is also something that we have interpreted for the SDGs as well. This is based on the 2015 GMP data. In the left side, it's about drinking water. So at the national level, now we're talking about 63%, while 53% goes for rural and 89% for urban. And then in terms of sanitation, it's 39% at the national level and 33 and 56% at the rural and urban areas, respectively. But then hygiene is also in the right side. This sanitation and hygiene, as I said earlier, we are very much behind the plan because in our country, because of many, destruction of infrastructures and because of the many needs, the first, demand by the people was for drinking water. Sanitation and hygiene was very much, ignored because of many different reasons. So that's why you can see the progress on drinking water is quite good, but in terms of sanitation and hygiene is not. And that's the reason that the mortality and morbidity rates in Afghanistan is high compared to South Asia member countries, and also based on the compared to the global level. Down to this in the next slide, you can see the very summary of the achievements. So now recently, before, because you can see there is a difference between, I think, the it's fine. If you look to the previous statistics, it's not mentioned here. The coverage was 58% in terms of drinking water, but the statistic is based on the new data that recently issued by the government. It shows that 53% we have access to drinking water in the rural areas, and also 33% to sanitation, while open defecation is still 18%. And under 5 mortality rates have been reduced to 55%. This is based on the data that was issued this year and is not officially published now, but we've got the final version now, and this is the statistic. And the next, the SDG targets, goals, and the national priority programs have been set based on this baseline. So here we're in the next slide. We're just moving here in my country. We have steering committee for SWA and for the SACOSAN. So this committee is mainly looking to the commitments and action points from both partnerships. What we did recently, that Ministry of Economy is leading the SDG process in the country, but then every sector is working to come up with the baselines and indicators for the sectors. So for WASH, we did the same in consultation with the whole partners. If you're now looking to the SDG targets, we are talking about the safely managed, drinking water and sanitation. But the current coverage that we have, if you're going to comply that one with the criteria of the SDGs, then the coverage comes down. So the first bullet you see, for the urban it comes down to 30, and rural it comes to 10, and national level it goes to 15 or almost 16. But then sanitation is becoming very, very below what we are expecting. And if you really translate the SDG targets and criteria to the Afghanistan context, this is the reality. So now this is what I was supposed to share with you, that how we are going to incorporate WASH in the SDGs. I don't want to explain this slide because it's very clear to everybody.
Engineer Ghulam, could you just tell me the slide you're on? I think I might have lost track on you. So are you on the, what number?
I'm on slide number, is it 4, I think, slide number 4.
Oh, okay. So this is
okay. It's the WASH in SDGs, goal number 6, ensure availability. It's right on the screen. I don't know if you're... No, it's slide number 8. I'm sorry, slide number 8
yes,
in the screen.
Okay.
you're right.
Yes.
So here it's very clear in the SDGs what are the targets and the indicators. I'm not going to spend time here. So in the next one, here in Afghanistan, we've just revised the national wash policy, and for that we are much thinking of the technology options, the approach in line with the SDGs. So in my country, if you remember the previous photographs, we were much depending on the hand pumps and on the very basic sort of toilets. But here you can see the photograph that we are now focusing much on the long-term solutions, like mainly on the water supply networks and improved toilets. This is because although it's a bit expensive, but in Afghanistan the solar networks and the water supply gravity networks have been very much increasing, and that's the approach of the new policy that we are considering now. Again here, we've also started to, in the rural areas, to have the house connection system. That was not the case before because we were providing, public stand posts and water points. But now it's connected within the houses with the meter system for the cost recovery mechanism and sustainability. This is one of the changes that we have brought. And in terms of sanitation, CLTS has been scaled up in Afghanistan because of the very promising result that we had. In the ANDS para and the MDG para, the approach was different. If I just give you one example that between 2004 and 2010, we were able to construct through the sector about 100,000 toilets, either upgradation or new one. But that was with the subsidies. But then while we started the CLTS from 2010 up to now, I can say that over almost 1 million toilets have been either rehabilitated or upgraded or newly constructed without any subsidies. And that's the focus on the CLTS, that very much the people have been mobilized and provided awareness. That's something that in our country has worked very well. So this is what we have also planned to implement and expand in the Citizens Charter. And this is something that we are also planning to, while we have the open defecation-free communities, then we're planning to implement, the next step would be to implement the sanitation ladder and to go to the another steps of the toilets within the communities. Here is the Citizen Charter National Priority Program in the next 10 years that I was happy to share with you. As I said earlier, the Afghanistan National Development Strategy was in line with the MDG, but now we have the Citizens Charter, which is a government national priority program in line with the SDG. So through this priority program, our plan is to increase the coverage from 53% to 73% by 2030. That's the first phase for 3 years, and then we have the next phase of 7 years. That, of course, very ambitious. It says that, in the next 10 years, we are going to provide not, improved and safely managed services, but improved basic services for the rural communities in terms of wash facilities. But of course, we'll have some time to go up to 2030 to also focus on the SDG criteria and approach. I'm sure for Afghanistan it would be very ambitious, but we have a very good momentum in the country to proceed. In terms of sanitation, we are planning to increase the coverage from 33% to 47%. There might be a question for you that it's only the Citizens Charter that we have planned, but the other programs like we have through the donors still continue, but most of the assistance will be channeled under the Citizens Charter for WASH. And I'm sure the government is also, because we have the High Council for Water and Land, and there are also new ideas what would happen after the Citizens Charter, because now SDGs are being discussed at the very higher level, at the presidential level and at the cabinet level. So that was the concern, that if we are going to reach by 73% in the next 10 years, and then 47% for sanitation. So what would happen after? So now the government is thinking to again come up with the ideas after the Citizens Charter. What would be the next backup of this national priority program to continue providing these services? So in the next slide, as you can see, this is I think what I explained earlier. Again, this is the coverage of wash facilities. I'm not going to share with you. See, this shows that where we are going to be by 2020. So I explained in the previous slides. So I hope I've not taken much of your time. I'll leave the floor for discussion. This is the last slide which talks about the SWOT analysis. So I mean, it's I don't prefer to present that one, but just one thing that I'm again eager to share with you, that in Afghanistan, one of the effect of the SWA and the regional partnership has been that in my country, as you can see from the statistics, drinking water coverage is high. The reason was that, most of our policymakers were not, convinced to invest on sanitation and hygiene. But while our ministers, participated at the regional and global partnerships like SWA, so once we were back from 2014, HLM, the finance minister, because he was there. So now we have a specific budget line from the government, from the national revenue for sanitation and hygiene. And I think this is a very interesting point, although we have a small amount in that, but this is a good start. So, and also for the regional partnership that we have, the SACOSAN, we had the first Afghanistan conference on sanitation, and the participation for this sanitation and hygiene that was very much ignored before. We had the First Lady, and we had the sector ministers, we had the partners. So these are something which is very promising, and you all know that our country is over 80% dependent on the international aid. So I'm sure with the support of all of you and the SWA and the SACOSAN, we are able to proceed, as expected to the SDG goals and targets. So thank you very much, and I'm sorry if I've missed something, and I'm happy to respond to any questions. Setali, is it okay for the timing that you've given to me?
Yes. No, thank you so much, Engineer Ghulam. This is really inspiring. Adding on the initial presentation that we had from Indonesia, and the insights that you have brought us on the Citizens Charter, this level of prioritization within the country, looking at the planning horizon up to 2025. This is all really interesting. So, and I have seen also that we have been joined by a few more colleagues, particularly those that are in the East Africa region, as they're getting up to start their day, and they're joining us as well. So that's really good. We have Cameron as well from Pakistan, who's just joined while Engineer Ghulam was speaking. So for those that I might have missed, please put in the chat your name and where you're joining from. If you're joining with other people, please let us know. We just had this presentation from Afghanistan, and before that we had a presentation from Indonesia. So if you do have a question, please do put in the chat, or if you have a device that is mic enabled, please just feel free to pick up the floor and to ask the question or contribution, or make the contribution that you have. Cameron, that's okay, and thank you for joining. So I'm just checking to see if there are any questions for Engineer Ghulam. Okay, so the question that I have is Engineer Ghulam, would you tell us how the national and sort of other levels of government, how they operate here? So I think the consultation coming up to the Citizens Charter, how does that work at these various levels of government?
Thank you. Well, Citizens Charter is first is, as I said, it's a national program. It's both for rural and urban areas, and the level of participation is that the main meeting, which is almost twice in a year, is chaired by the president, and then we have below that we have the ministerial level participation discussing the Citizens Charter progress and issues. That's participated by the minister and chaired by the finance minister. That's on a quarterly basis. But below that we have the technical steering committee. That's at the level of deputy ministers. And all these participations are from the sector government ministries. The number are too many, but it covers the whole, level of the governments. But then there are also some task forces within the sectors for each sector. So the Citizens Charter is focusing on the health, child, mother, and health, basic education, rural energy, agriculture extension, and WASH. So this one of the good thing for the Citizen Charter is that all these sectors, the meetings and discussions are held at the same time. So it means that Minister for WASH, for energy, for agriculture, and education and health are getting together to discuss about the Citizens Charter. So this shows, in addition to the good level of participation, shows a very good coordination and sort of getting together to bring linkage between the sectors. We all know that WASH has a direct connection with health, education, and also even agriculture, while we're talking about composting of the waste. So these are the issues that are here. But specifically for WASH, we have participation of the whole CSOs, the NGO partners, the development partners, and the government sector ministries, the member of the steering committee for SWA and for SACOSAN. And while we're talking about the Citizens Charter, again, this level of participation are the one who are talking about that. So recently, because in Afghanistan, the indicators for SDGs was, should have been in line with the Afghanistan context. So that's why we got together in a couple of days with the whole partners to discuss what would be the baseline for the SDGs for the WASH. And that was a good step that we agreed that, and then we shared with the Ministry of Economy so that could be shared with the UN. So I hope I've answered you, Sitali.
No, thank you. That's great. And sort of there's various task forces and how they help to drive the progress on planning. That's really good, because I was asking that because there are a number of models that we're hearing. Some countries that talk of a very bottom-up approach where either provinces or states do the initial planning for the SDGs and then they consolidate that at the national level, or others that start with the national level setting the broad parameters and then cascading that down to the lower levels of government. And so sort of hearing these various approaches, and maybe there are others out there that might be thinking, how are we going to approach ours? That helps. We have a question. So we have two questions actually. So one is how is Afghanistan planning to strengthen the capacity of sub-national structures of the of the sector. So this is a question you could take Engineer Gulam, but let me just check if I know Audi in Indonesia has had to go to another meeting. But could we just check with the Reza and other colleagues from Indonesia as to whether they could maybe also tackle this question? So you can just let us know in the chat if there's anybody in Indonesia there who could answer this question as well on sort of dealing with capacity, strengthening capacity at subnational structures. I imagine this is for planning or perhaps other things as well. And that question is coming from Abera in Ethiopia.
Could I go very briefly, Kamran, to respond this? Sorry, Setali,
yes,
to
please.
respond this?
Sure.
Well, I am sorry. This was actually part of my PowerPoint. In Afghanistan, capacity at the subnational level is an issue. This is a very right question, thanks to the person who asked. Yeah, but what we've planned for the Citizens Charter, previously our experts were only at the provincial level, so we didn't have any capacity and resources at the district level and also at the community level. The good approach that we have in the Citizens Charter, that we are now going to the community level, so there will be a very strong office at the district level, and the district level, all the surveys, designs, monitoring, supervision, and implementation would be conducted at the district level. At the provincial level, we'll have only very limited experts just to support the district levels. But then down to that, we have also the community. In Afghanistan, districts and communities are somehow, the same. And the outreach now goes almost to the community level. Previously, the surveys, design, and everything was done at the national level and also at the provincial level, but mainly at the national level. Now the capacity goes at this level. But under the Citizens Charter, the first year that we are now in 2017, from early January up to now, the program is focusing on the trainings and capacity buildings of the program for the communities, for all the stakeholders. So this is something that we did also for the National Solidarity Program. And the CDC's community development councils, the cluster community development councils are going to be elected now, because we've had over 10 years the same, chairs and members. So there should be some changes. So after the election is done, then there will be a specific focus on trainings and capacity buildings of the communities and also the stakeholders. So I hope this is an answer for the question. Hello?
Hello. Yes, sorry, I was on mute and I kept on talking. So thank you for that. I just wanted to check with colleagues in Indonesia to see whether there's anyone among them who could also contribute to this question on capacity at subnational levels. Is that possible? Our colleagues in Indonesia?
Hi, Stali, this is Reza. So Aldi already left, so I think Aldi is the best person to answer. Yes, but what I understand as far is that we the capacity at the sub-district level, but it is not, like there's a gap between some district may have a strong capacity, but not on the other districts.
I see. Okay, well, thank you so much for that, and I think we can still continue the conversation as well. But thank you for putting that forward in terms of the differences in capacities that would exist from among districts. So there was one more question, and it looks like Engineer Kada has responded to that in the chat. This is the question from Dr. Tay, which was focusing on WASH in schools and WASH in healthcare facilities. So I think that has been taken care of. Let me just check, is there anybody else with a question or comment on this broad issue of planning for the SDGs? Do we have anybody with a question or comment that you would like to make? You might have worked through a planning process for the SDGs to integrate the SDGs in a sector plan or at a national level. And if you think that there are sort of challenges that you faced, and if there were any key solutions that you had to dealing with those challenges, you could take the floor and just share very quickly. Okay, so just one more part, and then we should be closing. Okay, so what we've gone through today is basically this planning component on the SDGs, which somehow was integrated in the preparations for the high-level meeting. So like I said, ministers looked at the baseline for the SDGs, and they also looked at where they intended to go. Then there were discussions on the sector building blocks, just looking at whether they were fit for purpose, as well as the collaborative behaviors. Now, in the interim months since the high-level meetings, countries have continued with the process of preparing or integrating their plans in the to ensure that their targets for the SDGs are on course. And if you think that there's still support that would be required from the secretariat, so for example, on say the use of the costing tool, like Lalit had said from Vietnam, if you still needed support to do that, that support is still available from the secretariat. So you can let us know. The support is available through the secretariat can facilitate that to happen. There were also other tools that were mentioned. So, for example, the World Bank UNICEF paper, which is not necessarily a tool, but it's a paper on financing for the SDGs, that is still available. The collaborative behavior country profiles, these were developed and shared with countries. And it looks like there can be more conversation that can be had on how to use those profiles, how to develop in intermediate steps to take in order to ensure that there's some action towards those collaborative behaviors. On the building blocks, we continue to encourage partners to use various sector diagnostic tools that are available, and most of these have been presented on a number of webinars. So the washbat, for example, it can be very helpful in analyzing the building blocks, and there's an online facility to use that too. And if a country wanted to use that, the best point of call would be through UNICEF to see if they could support, but they make the decision at the country level to see. UNICEF would be able to determine whether they have the ability to provide the support or not. But you can still let us know, and maybe we can liaise with our colleagues at UNICEF if that was not something that happened at the country level. But just highlighting that the washbat is a very significant sector diagnostic tool. And we also encouraged countries to use the recent GLASS survey, as well as a questionnaire that we had sent. And these are just in the event that you don't have anything that could help to do the sector diagnostic. So you could let us know if there's a tool that you're interested to use that we could put at your disposal. The next thing to highlight is that we're having the next webinar, which will be next month in August. That webinar will be focusing on review processes for the SDGs, and we'll kickstart the webinar with the just released JMP report. but we'll be looking more at process for reviewing progress on the SDGs. That's mostly tackling issues such as the joint sector reviews, and also other mechanisms for having multi-stakeholder discussions on progress. I wanted to end by highlighting two additional issues. One is to request for the main focal points, the government focal points or other focal points from other constituencies. We are currently going through elections for the steering committee. Some of the colleagues on the call have cast their vote, others have not yet done so. So if you know that you are a main focal point in your country, you most likely would have received an email from me to remind you to cast your vote. The voting period closes at midnight Tuesday today, at 11:59 Central European Time. And we hope that all those that are main focal points will have been able to vote by that time. And finally, I wanted to indicate again and to introduce our colleague, Nelson Gomonda, who just joined us about 3-4 weeks ago. He joined us from the African Ministers Council, and we're really excited that we're having this extra support and capacity to contribute to the engagement around the SWA framework. So Nelson is on the call, and I'll just give him the space so you can get to hear his voice, and you'll be reading from him very soon, and definitely hearing from him. Nelson, if you could just say a few words to greet everyone. Nelson, just a second, we can't hear you. Okay, I think you can go now. You can go on.
Yes, so I was saying that many thanks to you, colleagues, and many thanks to you, Starly, for this introduction. I know you did an email where you included, of course, this particular introduction, but I'm looking forward really to also touch base with colleagues in various countries as the days, weeks, and months come. And today I can say really it was quite an interesting moment in the sense that I was meeting a number of people virtually, but more importantly is that we have had quite wonderful and very interesting presentations from Indonesia and also from Afghanistan. And one thing that I'm taking away here is the fact that definitely as we move into the planning and implementation of the SDGs, especially SDG 6, political leadership at the highest level is quite important because it helps in terms of setting the environment that we need for us to operate. So it's been quite an interesting moment to hear all these presentations, and I'm sure I'll be joining the other colleagues that have been asking for this presentation. I hope that we can be sharing these presentations, and I believe also that there will be other spaces where such wonderful stories in terms of how other member states are going forward with the design and the planning for the implementation of SDGs. I'm sure there will be a chance to share some of these things during over regional meetings like SACOSAN, and I believe that other regions as well would have a chance to learn from us. So let's see how best we can articulate most of these issues and share a little more global as well. But many thanks again, and I'm happy to meet you all, and I'm sure I'll be in touch as we go along. Thank you so much.
Great. Thank you so much, Nelson. With that, let me just say that so this is the first webinar in a series of 4 in the next 24 hours. So for our colleagues that in the East Africa region, just so you know, we'll have another webinar tomorrow at 9 a.m. New York time, which is close to, I think, your 5 or your 4 or 5 p.m. If you wanted to join that one, please feel free. We have a French webinar that's starting at 9 New York time today, and then we'll have the Spanish webinar at 12 New York time tomorrow. So for those that might still be interested in also hearing other country perspectives. But thank you so much, and hope to speak to all of you soon. Please remember, if you need to use the costing tool, let us know. If you haven't voted in the steering committee elections and you're a main focal point, please go and cast your vote. Thank you very
Sitali, can I have a
Yes, yes.
sorry, I didn't see the link for putting the votes and the email. I'm just trying